Thank you, Premier. Good morning, everybody. 2 weeks ago, I stood here and mentioned that New South Wales Ambulance had transported 2,500 COVID patients in the preceding 2 months. Today, I stand here saying that as of midnight last night, there were 5,900 COVID or suspected COVID patients have been transported by New South Wales Ambulance. So in just 2 weeks, this load has doubled on the organisation from the previous 2 months. It's a very challenging time for our paramedics. What I am pleased about is we can clearly see the impacts of increased vaccination as clearly dampening the curve for us and assisting to keep these numbers hopefully down into the future where we get increased rates again to flatten off and reduce the demand on New South Wales Ambulance. Importantly, I would like to begin again by just acknowledging the incredible work that my colleagues are doing out there every single day in support of their community. Our paramedics, as I've said before, they're out there in full PPE, they have to change it every single time, they have to deep clean their ambulances. This is having a very big load on our clinicians, and yet they turn up every single day just to serve their community. Our control centre staff are taking calls at a rate that they've never had to before. More than 1.3 million calls per year come to 000 to ambulance alone. And in this environment, we're taking more than one every 25 seconds somewhere across this state. I'd like to talk to you about 3 particular initiatives that we're doing at the moment that I think will be important for the community to be reassured about. We're working very closely with New South Wales Health, and in fact I have the Deputy Commissioner working over here full-time at the moment, setting up the New South Wales Health System Control Unit. Now what this is a model where we're taking real-time data from New South Wales Ambulance, we're combining it with data from the emergency departments and the intensive care bed state. Now what this does is it gives us the whole of system view to make sure that as we see some of our hospitals reaching their peak capacity, we're actually able to decompress them and transfer load across the system. Now, to the best of our knowledge, this level of integration has never been achieved on this scale anywhere in the world. And I think it bodes really well for the success of the difficult times that we are going to have as a health system going forward. But it's important to know individual hospitals are not just individual hospitals. They are connected to a very broad system. And yes, it is challenging, but everybody is doing everything in their power to make sure we share the load and keep our patients safe to the best of our ability. Another important element of what we're doing is obviously assistance to our regional communities. Across New South Wales, we tend to have smaller hospitals in regional settings. The risk that they could be overwhelmed by comparatively smaller numbers of COVID being very unwell is much higher. So what we're doing is we're surging our retrieval resources, our doctors and nurses of our retrieval system and critical care paramedics. We're putting on additional aircraft. We've secured 2 with our partner airline with RFDS out in Dubbo as we speak. And we'll be doing further in the south and the north of New South Wales. Importantly, we're also adding to the clinical support that our state retrieval consultants are providing to the regions. So we're having additional consultants being there to give advice to other doctors who may be remotely located as to how to treat this very difficult and complex virus that is COVID. The other really important thing that I'm very pleased to announce today is another 60 paramedic interns hit the road as of tomorrow in the greater metropolitan area. This will be a great relief to many of our crews. We've also made a decision in partnership with the Ministry to bring forward all the rest of our recruitment for the rest of this year, which will see another 130 paramedics commence with New South Wales Ambulance on the 27th of September. You can imagine for our staff, this is a very challenging time. We are being impacted by the load on New South Wales Ambulance. Today alone, we will see another expected 3,400 unique 000 calls. This is the sort of thing we see regularly on a New Year's Eve. For the last 2 weeks, we have not had a single day where we have not been at status 2, which is high, across the entire metropolitan area. The impacts of our response performance are being hampered somewhat by the impost of having to do donning and doffing in relation to every single patient. But this is a necessary thing to keep our paramedics safe, and not only them, but also the rest of the community and the patients they're treating. The time it takes to also decontaminate vehicles after they've been treated, patients have been treated, also adds to the lack of availability of ambulances. So not only have we got significant increased call volumes, but we've got a decreased availability across the system. And that's why strategies such as what we've been doing for the last really 6 months of surging additional workforce have been so important to put in place as we now come into the really difficult end of this COVID pandemic. Just in conclusion, I think again it's important to remember the job that our paramedics are doing and what the community can do to help to keep them safe. Many of you here today would have met my paramedic colleague, Joe Ibrahim, 2 weeks ago. And he spoke very openly and honestly about why he does the job that he does, and that is to serve the community and to take care of his family and his 2 beautiful boys. I'm the proud leader of an organisation of 6,500 people, just like Joe Ibrahim. If you ever want to do anything to help keep a paramedic from harm, go get vaccinated now.